It is a great honor today. We did, as we know, several of you might have been with us in September when we had a little soft opening of this room, but this is our official, and let me tell you, it looks fabulous, doesn't it? It really has grown from September even to the 2 weeks ago. Several have asked me before about the USO and how did this come about and how did we make this happen? And I don't know how, as we call it, Haley, every day we have quite a bit of tour groups that come. I have quite a lot of stars, 4 stars that come, and one of the 4 stars said to me, "Did you ask permission?" And I kind of looked at him and I said, "Well, no, sir, I don't think so." So my boss is here and she'd probably say, "Why would you ask permission to do something that's right for our veterans?" So that's really what this was about. It was such a great opportunity as we were working with the USO and our Armed Forces Family Foundation, who I always call as Yum Foods, who had been here before with us and did such projects as the Internet Cafe. And then when the USO was moving into Tampa at the airport, gave us another opportunity to see this come to fruition. So it's a dream of many that are in this room to really understand that to heal patients, both active duty and veterans, you must heal the whole family. And this is a room that allows our families to come into what we think is a healing environment. And with healthcare, healing and environment have to go together. And so we can't thank all those that were present today to help us. I have some prepared remarks, but they know that I never get on my prepared remarks, so I'll try to get there to tell you a little bit about why we came. So in 2005, this building that you're standing in, the Michael E. Billaracca Spinal Cord Injury Center, it was built and remains the largest VA spinal cord center with 100 beds. Here today, 93 of those beds are occupied. They receive high quality active and long-term care to meet the needs of our active duty patients and our veterans. We just can't tell you enough about the spinal cord injury patients that are here, and their stay is not a usual 5 to 7 day stay. As you know, through an acute rehabilitation, it's hundreds of days, and there is a long-term care of our spinal cord injury, which is a lifetime of care, as well as our spinal cord injury patients come back annually for visits that are usually a week in duration. So it's not that usual time. And that thought was not, if you're here for a long time, do you like to get that tray of food given to you every day, right? It's just kind of, Davis is laughing at me and Stephen's laughing at me because they've been in these beds getting that tray. There's nothing wrong with the quality of food, but it just doesn't look that well. So we had this vision. Down the road, when you go out, you'll see the American Heroes Cafe. And we started it as a restaurant-like experience, similar to what we're going to do today as a home-like experience. And the American Heroes Cafe was dedicated just about a month ago, and it operates every day at noon, and I am pleased to tell you I haven't had one complaint. I will tell you that I've had some doctors that are in the room that are a little worried of the caloric content that I am getting, because as they say to me, they can have as much as they want and the food is excellent. So we're really pleased. So this was the next comes the latest, and what we were able to do and why we became this was a room that was outside. It was an outside courtyard. It was done for art and some of the outside therapies, but then we put that beautiful polytrauma building on top of it, and it made this then become an area where we could then do the vision that several had, to use a room that could really allow our patients and their families to come in a home-like setting. So we're kind of new. You know, one of the things that the Department of Veterans Affairs hasn't had a lot of. First walked in 31 years ago to the VA, I would see such things like a little table, maybe a coloring book. That was kind of what we did for children. And isn't it nice to see that we've really woken up to the fact that our patients have children and they like to play. Now, I have some other people called the infection control people that like to now tell me how now I have to keep children's toys clean and not spread infection. So we're on it, and we're going to get there of making sure that that happens. But isn't it nice to see that there's an actual area where your children can play safely and have some fun, and it's okay, and you're still in a hospital? The other things that we see, some of the furniture's not in the right areas, but one of the things that we saw was a place that you can get in a nice sofa or in a nice chair and have a nice warm feeling and have a movie that you want to roll up and see and have an enjoyable evening with your family. Now we do, what's most important is what we do here every day, and that's therapy. And in rehabilitation, we have therapy. Now you may say, Ms. Fogarty, do you really think that pool is a therapy? Pool as in billiards. Yes, it is, and it is a sport, right, Ms. Williams? It is a Olympic sport. So please don't make fun of saying that. Pool, billiards, and air hockey, we do have therapies, and they have been using this room since September with therapeutic approaches as well. So it isn't that we used all of that healthcare Family Forces Foundation that came together and came really as our partners to really make this happen. And without you, we would never have been successful. So thank you so much for coming today. Thank you for being such great supporters and allowing us to do the great work we do every day at James A. Haley. Thank you.